Have you ever thought about trying testosterone, but asked yourself, is it truly worth it, and what risks come with it? I'm Dr. Rena, a urologist and pelvic surgeon, and today I'll walk you through testosterone replacement therapy, including its benefits, its risks, and who may actually benefit from it. TRT is typically used for men diagnosed with what we call hypogonadism. This basically means having low testosterone levels confirmed through blood tests, usually below 300 nanograms per deciliter, along with noticeable symptoms. These symptoms can include a reduced sex drive, mental fog or trouble remembering things, ongoing fatigue, feeling less energetic than usual, mood shifts like depression, difficulty building muscle, increased body fat, and even erectile dysfunction, especially trouble with morning erections. Hypogonadism tends to become more common after age 40, especially if you also have other health conditions, what we call comorbidities. These can include diabetes, high blood pressure, high cholesterol, or other metabolic problems that raise the chances of developing low testosterone. TRT can be quite effective for men with hypogonadism, particularly when it comes to improving those symptoms I just mentioned. But the important question still remains: is it safe? A major study published in 2016 in the well-known New England Journal of Medicine looked into this. The researchers focused on men aged 65 and older who had moderately low testosterone levels, examining the possible benefits of increasing those levels through treatment. In this study, a total of 790 men were included. Each participant had an average testosterone level below 275 nanograms per deciliter. They were randomly assigned to use either a testosterone gel or a placebo gel over the course of 1 year. This research, known as the testosterone trials, showed that treatment led to clear improvements in several areas, especially sexual activity, sexual desire, and erectile function, compared to those using the placebo. When it came to physical ability, men in the testosterone group were able to walk longer distances within 6 minutes. About 20% of them improved their distance by roughly 50 meters, or 164 feet, compared to 12% in the placebo group, which was a meaningful difference. They also reported better physical function scores on surveys and generally felt that their ability to walk had improved. In addition, there were small but noticeable improvements in mood, depression, and overall energy levels compared to those who received the placebo. Overall, many participants said they felt more energetic, and that's important because it showed that the benefits weren't limited to just sexual health. You're also seeing gains in physical function, the ability to walk farther and move more comfortably in daily life, along with improvements in mood, which can be life-changing for someone dealing with depression. Other studies have explored additional benefits. One key area is body composition. Research shows that men on TRT for more than 3 years gain about 1.9 kilograms, or roughly 4 pounds, of lean muscle, while losing around 6.5 pounds of body fat. In contrast, men who don't use TRT tend to see only very small changes in either direction. Some studies have also looked at strength and performance, such as stair climbing power and exercises like the chest press or leg press, and they found noticeable improvements. There are also benefits when it comes to bone health. In older men on TRT, researchers have seen increases in bone density and strength, especially in the spine. You can see why this matters. As we get older, it's not just about building muscle, it's also about protecting bone health. Stronger bones mean a lower risk of fractures if a fall happens. It's important to remember that most of these studies focus on men who truly have hypogonadism, confirmed by lab results and symptoms, and who are generally older, often over 65. So if someone already has normal testosterone levels and takes extra, they may not experience the same benefits. That's because we don't fully know whether their testosterone receptors are already getting enough stimulation. In simple terms, more testosterone doesn't always mean more benefit. Now, to keep things balanced, there are some potential risks to consider. At the same time, there's also a lot of misinformation out there about TRT, so let's clear some of that up. One concern people often hear about is heart disease. Many believe TRT increases the risk of cardiovascular problems. But is that really accurate? This idea comes from earlier research that showed mixed results when it came to heart health. Back in 2013, A study examined about 8,500 veterans who had undergone coronary angiography, meaning they were evaluated for heart disease. These men had low testosterone and were treated with TRT. The study reported that those receiving TRT had a higher risk of heart attacks, strokes, and even death. However, this research faced serious criticism due to problems in how it was designed and how the data was analyzed. For example, questions were raised about how long the men were followed and how long they had actually been on testosterone before experiencing a cardiovascular event, making it unclear whether testosterone was truly the cause. They also relied on very complex statistical models that took the actual number of events, which was actually lower in the testosterone group, and adjusted them in a way that made the risk appear higher. This created quite a bit of controversy. Still, the story spread quickly in the media, and many people ended up stopping their TRT prescriptions. After that, another large study looked at 83,000 men in the veterans system, all with confirmed low testosterone. What they found was very different. TRT was linked to a 33% lower risk of cardiovascular events and death over an average follow-up of 4.3 years. What's especially important about this study is that researchers tracked testosterone levels after treatment. The benefits were mainly seen in men whose levels returned to normal. These men were 56% less likely to die during the follow-up period, 24% less likely to have a heart attack, and 36% less likely to experience a stroke. That's a very strong result. Think about it. If someone told you there was a way to lower your risk of death over the next 4 years by more than half, that would definitely get your attention. More recently, we have data from the Traverse trial. This was a randomized controlled study involving over 5,000 men aged 45 and older. These men either had existing heart disease or several risk factors, such as high blood pressure, diabetes, or obesity. Half of the participants received daily testosterone gel, while the other half were given a placebo gel with no active hormone. After about 33 months, nearly 3 years, the results showed no meaningful difference between the two groups when it came to major cardiovascular events, including heart attack, stroke, or death related to heart disease. In other words, TRT did not increase the risk of cardiovascular problems. There was also no difference between the groups in terms of heart-related procedures or the development of heart failure. Looking at all this evidence, and there is a lot more beyond what I've shared here, it suggests that testosterone replacement therapy, when used in men with true hypogonadism, is both safe and effective. It does not appear to raise the risk of cardiovascular events. That said, this doesn't mean TRT should be used without proper medical follow-up. There are other risks to consider, and it's important to monitor testosterone levels regularly to make sure you're not increasing the chances of other health issues. Another common myth is that testosterone makes urinary symptoms worse in men. But a recent observational study followed 259 men with low testosterone and erectile dysfunction. Some received TRT for 3 years, while others did not. What they found was quite surprising. The men on TRT actually reported improved urinary symptoms based on standard questionnaires. Not only did their symptoms get better, but their bladder wall thickness also improved, and they had a lower post-void residual. In simple terms, they were emptying their bladder more completely. It's important to point out that this study did not include men with severe urinary symptoms. Still, the findings clearly went against what many people assume about TRT. A larger meta-analysis looked deeper into this issue. It included 14 randomized controlled trials with over 4,000 men. The conclusion was that testosterone did not significantly change lower urinary tract symptoms compared to a placebo. It didn't necessarily make things better, but importantly, it didn't make them worse either. So why do people think testosterone affects urination? The reason is that the prostate is very sensitive to testosterone and may grow slightly in response. However, the prostate only has a limited number of androgen receptors, and these receptors become saturated even at low testosterone levels. This point is important and will come up again when discussing prostate cancer. Once those receptors are already filled, adding more testosterone doesn't have a major additional effect on the prostate. That helps explain why worsening urinary symptoms are not typically seen. As men get older, prostate enlargement is very common, so urinary symptoms can still occur, but they may be due to aging or other factors, not necessarily testosterone therapy. If you want to learn more about BPH, you can check out my podcast or YouTube videos where I explain it in detail. Now, let's talk about prostate cancer. Many people worry that testosterone therapy can cause it. TRT can lead to a small rise in PSA levels, mainly because of slight prostate growth once receptors are fully engaged. However, when you look at the overall body of evidence, there is no clear link showing that TRT increases the risk of developing prostate cancer. This is likely because, again, those receptors are already saturated. That said, prostate cancer is quite common, affecting about 1 in 8 men. And if someone is diagnosed with prostate cancer, continuing testosterone therapy is generally not recommended. So again, it's very important to keep monitoring your PSA levels while you're on testosterone. One large study followed 150,000 men over 15 years, focusing on those who developed prostate cancer while using TRT. What they found was reassuring. There was no statistically significant difference in overall survival or prostate cancer-specific survival between men who used TRT and those who did not. In fact, men who developed prostate cancer while on TRT actually showed more favorable outcomes in some areas, including tumor grade and clinical stage, compared to those who were not on testosterone. Alright, now let's talk about some real risks. One known risk is water retention and swelling. If you already have heart failure or tend to retain fluid, TRT could make those issues worse. Another concern is sleep apnea. In one study, about 10% of men on TRT developed new or worsening sleep apnea, compared to 4% in the placebo group. This is important if you already snore heavily or have a larger neck size, which can be warning signs of sleep apnea. If that sounds like you, it may be a good idea to get a sleep study done before starting TRT, so you can address any underlying issues first. Some research also suggests that this effect may be temporary, and symptoms could improve after about 18 weeks. It may also be more common in men taking higher doses of testosterone. Next, let's look at blood clots. This concern often comes up with hormone therapy, whether it's estrogen in women or testosterone in men. One case control study, published in the Journal of the American Medical Association Internal Medicine, found that men who used testosterone within the past 6 months had a 63% higher risk of developing blood clots compared to those who did not use it. This risk appeared to be highest during the first 6 months of treatment and then decreased over time. However, a larger and more comprehensive review looked at 13 randomized controlled trials involving about 5,000 men. These studies compared men on testosterone to those on placebo over periods ranging from 3 months to 3 years. The overall finding? There was no significant link between testosterone replacement therapy and blood clots, including deep vein thrombosis. So we're talking about clots in the legs or even in the lungs. Based on this larger and more comprehensive analysis, there doesn't appear to be a clear increased risk linked to TRT. That said, the researchers did note that the quality of evidence was somewhat limited, and there could still be meaningful clinical risks. So if you already have a higher risk for blood clots, this is definitely something to discuss carefully with your doctor. Next is fertility. When you take TRT, the higher testosterone levels in your bloodstream send a signal back to your brain, specifically to the pituitary gland, telling it to stop producing signals for natural testosterone. As a result, sperm production can drop. In a study published in the Journal of Urology, researchers found that after 6 months of TRT, about 65% of men had their sperm count fall below 3 million per milliliter. This level is considered severe oligospermia, or very low sperm count. So if you're planning to start a family, it's important to explore your options first. There are alternative treatments that can help maintain fertility, depending on your timeline. Another risk to be aware of is erythrocytosis, which means a thickening of the blood. This happens when your body produces more red blood cells, making the blood more viscous. Thicker blood can increase the risk of issues like clots or even stroke. A systematic review and meta-analysis, published in the Journal of Clinical Endocrinology and Metabolism, found that TRT increased hematocrit levels, basically the concentration of red blood cells, by an average of 3.1%. This rise could raise the risk of blood clots, especially in men who already have higher baseline levels. That's why doctors usually check these levels before starting treatment. The good news is that during the study, there were no serious adverse events reported, meaning no strokes or blood clots occurred within the study period. The risk of this blood thickening tends to go up with age, higher doses of testosterone, and certain forms of treatment, especially injectable TRT, which shows a higher rate compared to gels or oral options. No matter which form or dose you're on, regular follow-up is essential. You probably see the pattern here. It's very important to stay on top of monitoring when you're using testosterone therapy. Even if you feel great, even if everything seems fine, routine blood tests are necessary to make sure your levels stay in a safe range. What else? Some men may notice acne or oily skin while on TRT. It's not dangerous, but it can definitely be uncomfortable or frustrating. Now, some men may also notice breast enlargement, known as gynecomastia. This can happen because testosterone in the body can be converted into estrogen, and higher estrogen levels can lead to this kind of breast tissue growth. If it occurs, it may require adjusting the dose or adding another medication. Next is hair loss. But the key point is, yes, hair loss can happen, especially if you're already genetically prone to male pattern baldness. In those cases, TRT may speed up the process. So, who really benefits from TRT? Medical guidelines generally recommend it for men who have consistently low morning testosterone levels, usually below 300 nanograms per deciliter, on 2 separate tests, along with symptoms of low testosterone. These symptoms include reduced sex drive, erectile dysfunction, mental fog, mood changes, loss of muscle mass, and increased body fat. Now, what about who should not take it? Contraindications include active prostate cancer, severely untreated sleep apnea, and it's usually not recommended for men who plan to have children in the future. It's also not advised if you have breast cancer or uncontrolled heart failure, since TRT can lead to fluid retention. In the end, TRT can be very helpful for men with low testosterone and clear symptoms, but it's not without risks. That's why it's so important to have a detailed conversation with your doctor about your personal situation. Your medical history matters, and it should guide your decision. This is a serious medical treatment that requires careful monitoring and regular follow-up. So if you're thinking about TRT, make sure you're working with a knowledgeable healthcare provider who can guide you safely through the process. And as always, remember, take care of yourself because you truly matter.